Hey, everybody, it's Dr. Jonah Yakel, your natural healthcare practitioner, and I'm excited to be sharing with you on today's topic, anxiety and depression. And really, I'm coming in with the intention of this being a real game changer for a lot of people. We know that anxiety seems to be at an all-time high. A lot of us have probably heard that depression and, in fact, suicide rates have increased 30 to 40% in a lot of states. And unfortunately, our medical approach does not seem to be coming up with any of the answers. It seems like we're just being pushed more and more drugs, which don't seem to be working. And in fact, what a lot of people don't realize is that 30% of Americans, 1 in 3 Americans, are on a prescription medication with a known side effect of depression. And this includes things like high cholesterol medications like statin drugs, high blood pressure medications, antacids and protein pump inhibitors like Nexium and Prilosec, all kind of hormone replacement, including birth control. Like these have all been shown to have an impact and side effects of depression. And yet when someone goes in and they're complaining of having symptoms of depression, maybe they're exhausted, they're fatigued all the time, maybe they're feeling sad and they're crying all the time, or maybe they're not feeling anything at all. Maybe they've lost all interest in the things that they used to love doing, all their hobbies, and they're no longer finding that they're interested in having a social life or connecting with their loved ones or their friends. All they want to do is sleep anymore. And they're showing up at the doctor's office and we're just getting the same old, here, take an antidepressant, which again, antidepressants themselves have been shown to increase the likelihood to increase suicidal ideations. And again, it's not to say that these are not important and even necessary in a lot of cases, but I think what we can all agree on is it's not really addressing the true cause and the true source of the depression. And this is really where functional medicine shines, is it is all about uncovering where is this coming from. And while we know that depression is impacting so many of our friends, our family, our loved ones, even in a lot of cases ourselves, what we don't necessarily recognize, and this is where the real breakthroughs are coming in today's research, is that a lot of our mental emotional disorders, including anxiety, including depression, and even things like ADD and ADHD, bipolar, even schizophrenia, these are more and more being correlated to inflammation, specifically neural inflammation, so inflammation in the brain and in the nervous system. And the good news here is, again, we're starting to zoom in on where is this all coming from? What is causing all of this? And once we recognize that inflammation is not only driving a lot of our physical problems, of course, we know that it's related to cardiovascular disease. We know that it's related to cancer. We, of course, know that it's related to musculoskeletal pain and arthritis. We know that it's a big player in all autoimmune diseases. But now we've learned that it is also driving a lot of our mental emotional disorders. And I'm primarily focusing in on anxiety and depression. But once we know that it's inflammation, now the game changes, because now we can actually start looking and even measuring for levels of inflammation. How inflamed are you? And in fact, we've been using a new lab in our office called BrainSpan that is exceptional for this. And it's super simple and it's fairly reasonably priced. It's only $100. You can do a pinprick, you get a little drop of blood, and then you do a 10 to 15 minute computer evaluation, cognitive evaluation, and we send it in, and within 7 to 10 days, we're going to get a report back, a 5 to 7 page report on levels of inflammation, ultimately what kind of nutritional deficiencies are driving that, and how we can make some minor changes to our diet and add in some supplementation to totally start driving down that inflammation. And again, once we recognize that the inflammation is coming from somewhere, which of course we know that inflammation, just like depression, is not in itself a disease, it's a symptom or a sign of another weakness or imbalance, now we can set out looking. And from a functional standpoint, we know it's like, well, do we need to look at the endocrine system? Is this hormone related? Could this have to do with the gut? So much of our inflammation comes from our gut. And in fact, this has an enormous impact on our brain health, because 95% of our neurotransmitters like serotonin and dopamine are created in our gut. So our gut has to be healthy in order for us to even experience feelings of joy, and love and empathy and compassion, as opposed to those feelings of fear and anxiety and overwhelm and stress and depression and things of that nature. And of course, our gut is being bombarded every day in a toxic world. So our gut starts to break down. We start to develop things like constipation and indigestion and heartburn. And now the gut starts to become more and more inflamed, and we're not absorbing our nutrients like vitamin B12, which is going to drive up or again impact our ability to make neurotransmitters. So we're more prone to being depressed. Of course, so many of us have taken rounds of antibiotics year in, year out. And of course, that's going to impact our gut flora, which is also associated to neurotransmitter production, such as serotonin and dopamine. So, if we're taking any antacids, if we're taking any antibiotics, that's going to have a huge role on our gut health, which again is going to lend towards someone experiencing more stress and more depression. Maybe we're not getting enough omega-3s. Maybe we're not getting a high enough level of vitamin D, which has been associated with depression because we're not getting outdoors, getting the sunlight that we necessarily need. So often food intolerances, like an intolerance to gluten or to dairy, not only further inflames our gut, but it can lend to our body starting attacking itself, leading to things like Hashimoto's thyroiditis. So now the thyroid's not functioning appropriately, which again is going to lead to depression. So my point is that the depression itself is not the disease. The depression is a symptom of a bigger weakness or imbalance going on upstream, namely a result of us being inflamed. And we know the most common causes of inflammation. It's either coming from our hormones, our endocrine system. It could be blood sugar related. It could be gut related. And it could even be associated with an immune system that is not functioning appropriately. So if you're looking for an additional approach, if you're looking for alternatives or natural approaches to health or healing, or maybe put it this way, if you're looking to get to the root cause of why you're feeling the way you're feeling, I would love to help support you or your friends or your loved ones or your family. If you know anybody who's struggling with anxiety, if you know anybody who's struggling with depression, and they've tried a lot of the traditional approaches and they're just not getting the results that they'd like, I would be more than happy to help them out. Don't hesitate to pick up the phone, give us a call, send me an email. I'd be happy to have a conversation with anybody and get them back on track to healing, not only physically, but mentally, emotionally. Again, don't hesitate to share this video if you know somebody who could be supported. And I'm glad you tuned in, and don't hesitate to let me know how I can help and support you in the future.